Hey, good morning. I'm Patricia Murphy. It's Tuesday. This is Seattle Now. President Donald Trump's big, beautiful bill would make big changes to Medicaid. In a minute, we'll speak with a local family doctor who says the bill's passage would have devastating impacts on people who can't afford health insurance. But first, let's get you caught up. We are years from hopping on the light rail to West Seattle and Ballard, but legislation before the City Council today would make the permitting process for those extensions more efficient. Construction of the West Seattle Light Rail extension isn't expected to begin until 2027, with service in 2032. And forget about the Ballard link for now. That service isn't anticipated until 2039. King County Metro's Bike and Scoot to Transit program is back for the summer. Connect your Transit Go app to your Lime or Bird account, and you could earn free rides. Riders earn points depending on distance and time. And of course, wearing a helmet is the safest way to ride. The program is willing to supply you one. And new arts alerts starting this Thursday. Visit On the Boards for the Northwest New Works Festival or Seattle Public Theater for the Distillery New Works Festival. Both events will feature works in progress theater pieces and a behind-the-scenes look at how the sausage gets made on the stage. Sounds like a fun time. Check back for more headlines on tonight's episode of Seattle Now. If President Donald Trump gets his way, Congress will pass a major spending bill that would make big changes to Medicaid. The proposal would prohibit states from covering people who are undocumented, and it would implement work requirements for many recipients. The Trump administration and some Republicans say the goal is to reduce waste, fraud, and abuse within the Medicaid system. Here's Republican House Speaker Mike Johnson.
Young men, for example, who are on Medicaid and not working, they are choosing not to work when they can. That is called fraud. They are cheating the system. When you root out those kinds of abuses, you save the resources that are so desperately needed by the people who deserve it and need it most.
Washington Governor Bob Ferguson says under the plan, the state would lose $2 billion in Medicaid funding over the next 4 years, and nearly 200,000 people would lose their health insurance. Democratic Senator Patty Murray said the potential cuts would force families to delay care.
Moms and babies will lose health care coverage. They'll wonder how to get postpartum care or to pay for a checkup if their sick child desperately needs it. Emergency response times will skyrocket from closures, which cost precious time as the nearest ER gets further away, and crowding. As patients put off preventive care they can no longer afford until it causes problems that they can no longer ignore.
Republicans aren't unified in their support for the cuts. Here's Missouri Senator Josh Hawley.
It is wrong to cut health care for the working poor. And that's what we're talking about here with Medicaid. My state is a Medicaid expansion state. They're not on Medicaid because they want to be. They're on Medicaid because they cannot afford health insurance in the private market. These are working people and their children who need health care.
The House passed the so-called Big Beautiful Bill last month, and now it's in the hands of the U.S. Senate. Let's get the perspective of a doctor who treats Medicaid patients on a daily basis. Dr. Julian Perez is a family physician with CMAR Community Health Centers, a nonprofit that provides health care for underserved communities. Dr. Perez, thanks for coming in.
You're welcome. My pleasure, Trish.
Really appreciate it. So first off, tell me a little bit about CMAR and the people you serve.
CMAR is a federally qualified health center. This is a community health center that has a special designation by the federal government because we meet specific quality standards and access standards. Because of that designation, able to receive Medicare reimbursement rates for seeing Medicaid patients. And that's really critical for us to be able to take care of people who don't have health insurance. Otherwise, we would be experiencing tremendous losses that, for most community health centers, is an existential issue.
So these are people who would unlikely be seen in other places.
We wouldn't say we're the last resort, but we're nearly the last resort for most of our patients.
Okay. As I mentioned there at the top, Doctor, our state leaders estimate that nearly 200,000 people would lose Medicaid coverage if this bill passes. When you first heard about these cuts, what did you think?
So I thought about how bad would it be if we went back to the old days before we had Medicaid expansion, before people had access to a way to pay for their health care, when we were admitting patients with complications of chronic disease that could have been controlled had they have a way to pay for their insurance. Folks will come to the doctor if they have a way to pay. They do not want to walk away with a tremendous bill that they either can't pay or will take years to pay off.
Were you anticipating this?
You know, Donald Trump, for all his qualities, is a man of his word. And he has been very serious about cutting budgets and decreasing the resources to many different groups of Americans. And he's done it. So he's one step away with the Senate. And these are very, very critical times we're living in.
If this were to happen, how would your patients at CMAR be affected? What would the real world impact be here?
Again, going back to 2007, when we had an economic recession in this country, we had so many people that fell out of the middle class, they lost their job. And back then, your job was your health insurance, essentially. When you lose your job, you lose your health insurance. Now you're on unemployment. They would go through about a year and a half of unemployment, and then they were out of money. Many people lost their homes, lost their marriages, and they came to us with this group of people we had never served before. Our classic patients were migrant workers with a kid, a happy married couple, one on the way. And then all of a sudden, a year into this economic recession, we're seeing 50 and 60-year-olds who have 14 medicines, 10 major medical problems, heart disease, and it was a complexity that we had not been well prepared for. So I was afraid immediately that we're going to start to see a return to those days when people don't have access to care. They have chronic disease, it gets out of control, and we end up having hospitalizations that could otherwise be prevented.
Can you give us an example of a patient you care for, obviously anonymously, and what might happen if they lose coverage?
Well, I can tell you about a patient that has been in and out of medical coverage. She's about 59 years old. She has diabetes. She needs to have insulin to control that. Years ago, she had a pancreatic cancer, and she had a surgical procedure called a Whipple procedure, where they take out most of the pancreas and quite a bit of the surrounding organs. And it left her without any cells that produce insulin. So she's been using insulin for the last 20 years. Recently, her sons, for different life reasons, have had to move away and are unable to be by her side and live with her and take care of her. And so she's mostly on her own. And she lost her job because her diabetes was poorly controlled, ended up in the hospital with a foot infection. We had to amputate some of her toes, and then she was unable to work because of that. And so she became unhoused and was unable to afford any medications. And so we tried every prescription assistance program that we were able to find to give her at least some of the medicines to help her control her disease. And she was in and out of the emergency rooms nearly on a weekly basis. We had her in the hospital probably every 2 to 4 weeks for about a year and a half. And that is a person that is just failing. And it's not her fault. But because of the system that we have, she was uninsured for a good amount of time. Credit to the state of Washington and King County that we follow patients in this situation. If they are high utilizers of the emergency room, if they're in and out of the hospital, they're flagged. And they're given social assistance that comes in the form of health insurance, sometimes a cell phone, sometimes even housing. You have to meet those basics so that somebody can get back on their feet and get their health to the point where they can get reemployable. And this is what happened to her. She was able to get reemployed. Now she has health insurance. She's able to control her sugars better. She's not doing perfectly, but she's doing so much better simply because of these assistance programs. If you start to cut funds to Medicaid, all of these programs come through Medicaid dollars. The federal government gives the states Medicaid, and the states figure out how to use that for their populations. And that is right in line with what Republicans think, that decisions should be made on the local level. It's just that in Medicaid, I'm going to be very honest with you, Trish, there's not a lot of waste, fraud, and abuse. This is just not happening. Our patients come to us, they have nothing, they're desperate. And the money they get barely gets food on the table, barely helps them pay the electricity. And we take very little reimbursement for the visits that we do. And the medications, the formulary is a formulary that's very smart. It's nothing elegant, nothing that's going to be $10,000 a month. These are very affordable, effective medicines with a lot of research behind them. I can't think of a better healthcare program in the whole nation. It really should be scaled up and made a national healthcare program is what it should be.
Do you think Medicaid is getting a bad rap? Do you think the information is not accurate?
Absolutely. Absolutely. Medicaid is a program that came out 100 years ago to take care of people who were lost an eye, lost a limb, working in the factories. And slowly it's been applied as well to folks that are retired and indigent and have nowhere to live. And then we began to slowly expand this program and make it better and better. It's not burdened, even half as much as Medicare. That is a program that needs a lot of work because there's so much burden with paperwork and administrative costs. Medicaid's not like that. And so if we lose Medicaid, a lot of Americans are going to lose their health care insurance. And we're not just talking about undocumented people who pregnant woman comes to us in the state of Washington, it doesn't matter where she's from or how long she's been in the country. If you're pregnant, I got to get a pregnancy test. You'll automatically qualify for Medicaid coverage, and we're going to make sure that you and your baby are healthy and happy through 3 months postpartum. That doesn't happen in Florida. That doesn't happen in Georgia, because those states choose not to use their Medicaid dollars for that reason, to help moms and babies, who are, by definition, the most vulnerable population we serve. And in the state of Washington, we do this. And we have better public health outcomes. We have lower infant mortality, we have lower maternal mortality, and we have higher life expectancy than the states that don't do that, because we take care of moms and babies.
We're talking about potentially 200,000 people here in our state losing their coverage. What would that mean for the healthcare system at large? Emergency rooms.
Well, can you imagine during the COVID pandemic, so many people were coming to the emergency rooms sick, devastated with COVID. Now, just take another reason that people are going to come to the emergency rooms devastated with chronic disease complications and hypertension that leads to stroke, kidney failure that comes from untreated diabetes, all these things that we used to see before Medicaid was expanded, before there was the Affordable Care Act with new rules about how health insurances had to act, bringing them finally some ethical guidelines. There was pre-existing conditions that made it impossible for somebody to get insurance if they had a heart attack or stroke. Those days are gone, but they could very well come back. It's going to be bad enough if Medicaid rates are cut, as far as what we are able to be reimbursed for seeing patients. It's going to be bad enough if the dollars are reduced to the states so that fewer people get coverage. But can you imagine if they slip some lines in here and there saying, oh, by the way, if you have a pre-existing condition, you don't have to be covered by any insurance? Those days could come. We need watchdogs that are reading these bills very carefully, that are looking at these details and pushing back every step of the way.
Let's talk about CMAR for a second, because if this funding goes away, can CMAR seek funding elsewhere to help patients? Is there an emergency lever you can pull?
So CMAR Community Health Centers is one of the biggest in the nation. We have over 100 brick and mortar sites. We have an enormous budget. We probably care for about 300,000 people. Coverage areas between the Canadian and Oregon borders from the Cascades to the ocean. That's a pretty large area. There are other community health centers in the nation that are only 3 buildings, maybe 5 buildings, maybe $10 million budget. They could not withstand these types of cuts. Our portfolio of investments, so to speak, the way that we are able to pay the bills and balance the budget for our operations is very diverse. We have our own two of our own radio stations that we speak to the community in Spanish and educate them about public health issues. We have been doing subsidized housing now for about a decade and helping people get a roof over their heads because we know how important that is to people's health. We probably can withstand this, but it won't be without an awful lot of bruises.
I touched on this briefly, but for their part, the Trump administration has claimed this budget is about eliminating waste, fraud, and abuse from the system. What do you say to those claims?
I don't see frequent or true examples of waste, fraud, and abuse in the Medicaid system. Medicare, there might be a little bit of waste, and mostly it's people's wasted time filling out forms that don't amount to much for things that our patients need. Fraud in Medicare, there have been many documented cases of fraud in Medicare where a urologist in Texas will charge $40,000 to remove a prostate, while in the state of Idaho, they may only charge $15,000. Why? There's no good reason for that. Abuse, again, there's the abuse. The abuse that I see as a physician is when I see a patient who has a medical problem and I need to order a particular medication or I need to order a particular imaging study like an MRI. It's just like absolutely reflex, denied. And then they make you do a prior authorization form, which is very, very long and complicated. And by the way, these are private insurers, by and large, private insurers that are using AI to slow down the process and deny. And then by the time we do a prior authorization, then they say, well, now you need to speak with one of our physician representatives. And usually we were able to get those people on the phone same day. Now, sorry, you need to make an appointment, and you only have 2 weeks to do it. And if you don't get it within that 2 weeks, then the whole process starts over if you want it at all. These are built-in barriers to care. They should be illegal. That is where the real waste, fraud, and abuse is happening. It's at the level of these private insurance companies that are for profit and they want to get even richer and more powerful so they can continue to manipulate the system to their benefit. And I'm speaking as a single person on this. I don't represent my organization when I say this, but it is absolutely the truth.
Dr. Julian Perez is a family physician with CMAR Community Health Centers. Thanks so much for coming in.
Trish, thanks so much for the invitation. Anytime.
Appreciate you listening to Seattle Now, and big thanks to our newest financial supporters, Irene, Mary Lynn, and Candace. Your support means the world to us. Today's episode was produced by Andy Hurst. It was edited by Caroline Chamberlain Gomez. Our production team also includes Vaughn Jones, Brooklyn Jamerson Flowers, and Paige Browning. Greg Kramer does our theme music. Seattle Now and KUOW Public Radio are members of the NPR network. I'm Patricia Murphy. See you soon.